Welcome back. In this video, we'll be focusing on self-care for healthcare providers. As caregivers, we often focus all our energy on caring for others, but it's crucial to remember that our well-being is just as important. In today's video, we'll discuss the signs that indicate when it's time to withdraw, take a step back, and prioritize your own physical and emotional safety. We'll also explore the concepts of transference and countertransference, and why recognizing these dynamics is essential to self-care. Let's begin by talking about the importance of self-care for caregivers. Caring for others can be deeply rewarding, but it's also emotionally taxing. As healthcare providers, we are often exposed to the emotional struggles of our patients, and this can take a toll on our own mental health if we don't pay attention to our needs. The first step in self-care is recognizing when we're reaching our limits and being willing to withdraw when necessary to preserve our emotional well-being. Taking time to care for yourself is not a weakness. It's an essential part of being able to serve others effectively. In fact, recognizing when you need a break or when certain emotional dynamics are impacting you is a sign of strength. It helps you remain resilient and capable of providing the best care possible to those who depend on you. Step 1. Understanding transference. Transference occurs when a patient projects their feelings, desires, or expectations onto you, the caregiver. This can happen unconsciously, and it often stems from the patient's past experiences, particularly with significant figures in their life like parents, partners, or authority figures. As a caregiver, you may experience the patient's projections as if they're directed at you personally. For example, a patient might idealize you or become excessively dependent on you, expecting you to solve their problems in ways that are beyond your role. Alternatively, they may resent or feel angry toward you, reflecting unresolved feelings toward previous caregivers or figures in their life. It's important to recognize when transference is occurring so that you can maintain appropriate boundaries. If you don't, you may start to feel emotionally drained, resentful, or even overwhelmed by the emotional weight of the situation. Reflection questions. Have you ever felt like a patient's emotions or expectations were being projected onto you in a way that felt uncomfortable or overwhelming? How can recognizing transference help you maintain emotional boundaries with your patients? Step 2. Countertransference, recognizing your own reactions. Countertransference refers to the emotional reactions you, as a caregiver, might have towards a patient. These reactions are often rooted in your own personal history and unresolved issues. For example, if a patient reminds you of someone in your life who hurt you, you might feel an intense emotional reaction towards them, whether that's anger, sympathy, frustration, or even an unconscious desire to help them more than is appropriate. Recognizing countertransference is crucial because it allows you to step back and evaluate whether your feelings are a result of your own emotions or a genuine professional response to the patient's needs. If you don't address countertransference, it can lead to biased decision-making, burnout, or emotional exhaustion. Being self-aware is key. Regularly reflect on your emotional responses during or after patient interactions. Consider whether you're reacting to the patient's situation, or if something about their behavior is triggering a response from your own past experiences. Reflection questions. Can you recall a situation where you experienced countertransference in your caregiving role? How did it impact your emotional state or your interactions with the patient? How can self-awareness and reflection help you manage countertransference in your practice? Step 3. Prioritizing your physical and emotional safety. In any caregiving role, ensuring your physical and emotional safety is paramount. When we work closely with individuals who are going through emotional distress, it's easy to absorb some of their pain and emotions. This can leave you feeling exhausted, anxious, or even disconnected from your own needs. It's important to recognize when you're starting to feel overwhelmed and withdraw to protect yourself. This doesn't mean abandoning your patients. Rather, It means that you're taking time to recharge so that you can continue to provide care without burning out. This could involve taking breaks. Regular time off, even small breaks during the day, is essential to clear your mind and reset your emotional state. Setting boundaries. Know when to say no and when to step back from emotionally demanding situations. Seeking support. Don't hesitate to reach out to supervisors, peers, or even a therapist for guidance and support. Talking to someone else can help you process complex emotions and maintain professional boundaries. Reflection questions. What are some strategies you use to prioritize your own well-being and manage emotional fatigue as a caregiver? How can setting emotional boundaries help protect your long-term effectiveness as a healthcare provider? Step 4. When to withdraw. There will be times when the emotional demands of caregiving become too intense. This is when withdrawing temporarily from the situation is necessary. Withdrawal doesn't mean abandoning your patients, but it might mean seeking supervision or support from a colleague when you feel overwhelmed. Taking a break when the emotional weight of the situation starts to affect your mental health. Reassessing your workload or making adjustments to your responsibilities to ensure you're not overburdened. Being able to withdraw when necessary is a sign of strength. It shows that you recognize your limits and are committed to maintaining a balance that will help you serve your patients with compassion and care, without compromising your own well-being. In conclusion, self-care is essential for healthcare providers. Recognizing when you need to withdraw, understanding transference and countertransference, and prioritizing your physical and emotional safety are all critical for ensuring that you remain strong, capable, and effective in your role. Remember, caring for yourself is not a sign of weakness. It's necessary for providing the best care to those who rely on you. Now that we've covered the importance of self-care and setting boundaries, it's crucial to understand the role of suicide prevention and how to manage suicidal ideation in patients. In our next video, we'll be focusing on suicide prevention and risk management, a critical area of care that aligns closely with maintaining both your own mental health and that of your patients. Let's keep it going, and I'll see you in the next one.